Back pain can be a major interruption in your life and make the simplest tasks just about impossible. I know, I've been there before. And physical therapy can often help restore the health of your back and spine while improving mobility and reducing pain. Shraddha Patel and Colton Omler are physical therapists at Bronson Rehabilitation Services in Battle Creek, and they join us right now. Good morning, both of you.
Good morning.
Well, that was well done, right in unison. I was just telling you off the air, I had that for a long, long time, kind of a muscular problem. If somebody all of a sudden realizes that their back's been hurting them way too much, what should be the first thing they do?
Well, the management of back pain can vary depending on several different factors. The back pain could be acute, that means it's only 6 to 8 weeks, or it is chronic, which is more than 6 to 8 weeks. The acute back pain could resolve by just avoiding some movements at work, improving your posture, getting some rest, heat, and ice. But if your pain is not improving day by day, it is strongly recommended to seek medical help. The time is sensitive with back pain. If back pain is ongoing and present more than 6 to 8 weeks, it is highly recommended to talk to your healthcare provider. The sooner you get the treatment, better are the outcomes. So if your back is hurting, talk to your doctor about referral to physical therapy.
And how effective is physical therapy in cases like this?
So physical therapy can be very effective with both chronic back pain, which is like over 8 weeks or longer, and acute low back pain, like Shraddha mentioned, 6 to 8 weeks or less. There's the added benefit of early access to physical therapy, and that's consistent across evidence, totaling over 1.2 million patients across multiple studies. At times, physical therapy can reduce back pain in just a few visits. Other times, it can take longer, especially if you've had the back pain a lot longer. Physical therapy can also decrease your patient's out-of-pocket expenses the earlier you can access your physical therapy, and decrease the PT lesson need for other medical diagnostics or interventions.
I mentioned I'd battled it in the past, and usually it was muscular. I'd have a muscle kind of out of whack, and then I'd start compensating for it. And the next thing you know, I'd have a terrible neck pain or shoulder pain, and then pretty soon I'm just a mess. Is that typical that, a muscular problem will escalate into all these other muscular problems?
Oh, yes. If you have a muscle problem, it's very normal to see that you would compensate in different areas and you end up having other complications from it. Now, if you have muscle is hurting, there is usually a reason for it. So that's what we do here in physical therapy. When you come in, we want to evaluate why is that muscle in spasm or why is it hurting, because we are trying to figure out whether it is because something's out of place, you're out of alignment, or whether it's a pure muscle injury.
So then what I'm hearing is that physical therapy is a great first step to find out if back pain might be something more serious or just a muscle issue.
Correct.
So what should why should I choose physical therapy then for my back pain over other types of treatment? Then I guess that's one reason right there.
Yeah, well, physical therapy is very effective and it's safe, research-based management approach. The physical therapist studies the movement behavior of the patient and comes up with an individualized plan for you. The goal of physical therapy is to get relief and to prevent any future episodes by teaching you self-treatment and management. The mechanical diagnosis and treatment method that we use here at Bronson Battle Creek is a step-by-step evaluation method to get to the bottom of the problem, like I just mentioned to you. For example, if you have a leg pain, the therapist wants to know where the leg pain is coming from. Is it coming from your back? Is it coming from your hip? Understanding this can help a therapist to develop a precise treatment plan geared towards getting you full relief and also to achieve personal goals such as return to activity level that you were before hurting yourself. So a physical therapist spends quite a bit of time educating patient about posture, body mechanics, and how to maintain proper ergonomics at home, at work. So it's a more collaborative approach with your doctor to improve the quality of life. And it is also a covered benefit by most insurances compared to other services such as chiropractor or massage therapy.
So, if we finally get to the point where we're going to do something about our back pain, do we need to go to our a doctor to get a referral, or can we go straight to the Bronson Rehabilitation Services for therapy?
So that's a great question. Here at Bronson, we do have a very great relationship with our referring providers. We do communicate a lot via medical records, and with Bronson and Calhoun County, with their primary care providers, once we have a physical therapy referral from the primary care provider, we call within 2 hours to try to get you an appointment within 24 to 48 hours for a physical therapy eval. Again, that's in Calhoun County with those Bronson primary care providers. But Michigan also does have a direct access rule since 2015, and that allows any patient to see a physical therapist without a referral for 10 visits or 21 days, whichever one comes first. But it is still recommended that you do check with your insurance just to make sure that that is a covered benefit under your insurance plan.
Well, then finally, if we want to learn a little bit more about Bronson's physical therapy services in Battle Creek, where should we go?
So anyone can visit bronsonhealth.com /rehab. Again, that's bronsonhealth.com /rehab to learn more about all Bronson's rehab services, and you can even request an appointment online. Or call us at our office location here in Battle Creek at 269-245-8125. You don't need a referral to make that initial visit appointment.
Well, physical therapists Colton Omler and Shraddha Patel, we thank you very much for sharing that great information with us this morning.
You're very welcome. Thank you.